Hi everyone and welcome to Wind Down Wednesday. I'm Dr. Christine Sarna. I'm here by myself without the wellness team because it's summer and everyone's on vacation, so I hope you all got to go and get out of the heat a little bit as well. And I am of course joined here with Janet, our patient care coordinator and office manager. And Janet, what are we drinking today?
We have a Matua Sauvignon Blanc. I should show everybody the bottle. Love the color on this one. So it's a Matua Sauvignon Blanc. It's from New Zealand, of course, which is where the best Sauvignon Blancs come from. I love them anyway. Never met a better one other than New Zealand. And this one's nice and light and crisp. The Matua has 90 points, so it's a nicely rated wine. Not too expensive either. I mean, it's under $20.
Love it.
So that's really, really nice. But it's nice and light, it's fresh, it's crisp. Love having it chilled, of course. Notes of grapefruit. Maddie even said that she noticed notes of pear. Maddie's behind the camera today, everyone. So
I think I taste green apple.
Green apple.
Green apple.
I would have to agree. Would have to agree. And I think this goes great with anything like fish, chicken, just little hors d'oeuvres, which you know is nice to do in the summer. Have little noshes there instead of a heavy meal, right?
Love it.
So I know we're going to be talking about everything wellness today, but I thought I'd go over the July savings first. And the first one, stay hydrated. That's what we're trying to do here. You get a free skin booster upgrade when you purchase a hydrofacial. So with the hydrofacial procedure or treatment, I should say, we have boosters for, smoothing out fine lines and wrinkles, helping to clear up acne, maybe clearing up sunspots, things like that. But there's limited appointments available, so call now. We're open until 5, 9 to 5, Monday through Thursday, 9 to 1 on Fridays. And then we have a Glow Skin Glow Special, and this is for your medical grade skincare products. Get a free Elastin HA serum, that's hyaluronic acid for retaining moisture and hydration in the skin. You get a free one anytime you purchase $100 worth of Elastin skincare products. And that's why supplies last, because I've only got a few of them left. New month, new tox. Save $100 when you try Daxxify for the first time. So many of you know we offer Botox, Dysport, Jeuveau. We also offer Daxxify. So there is a minimum of 50 units Botox equivalent to qualify, and there are limited appointments available. So give us a call to get in on Peyton's schedule. And then feeling off balance, feel younger, healthier, and happier by optimizing your hormones. We'll be spending a good amount of time talking about that today. Receive $50 off a hormone consult to see, if it's right for you. And most people are pleasantly surprised they are, and they can really improve their quality of life. But more on that with Dr. Sarna. Again, limited appointments are available, so call today, and that way we can get you on the schedule for the month of July. So with that said, over to Everything Wellness with Dr. Sarna.
So everything wellness today, but I am going to start with what is my passion, which is bioidentical hormones. So we'll start with what is a hormone, right? So hormones are just messages that are delivered from point A to point B, and it's really important that that message fit into point B like a lock and a key, so we get the exact expected outcome when the message is delivered. And I'm pointing that out because there's a lot of lookalikes. There's hormones that are not bioidentical, that are not natural, that will not fit into that received message like a lock and key, and you're not going to get the predicted outcome. This, in fact, is where we started to see scary things like breast cancer and blood clots and heart attacks and strokes and dementia. So there were studies back in the 70s where we got this huge scare away from hormones because we saw an increased incidence in all of those things, but they were not bioidentical or natural hormones at all. They were synthetic kind of lookalikes. And so we know better now. We don't use those. We use only natural bioidentical hormones. And that means you're not going to pick your hormones up from the grocery store, CVS, Target. You're going to go to a compounding pharmacy to get those because they're going to create prescriptions specifically for you as an individual.
Nice.
So that's my passion.
Well, and the other thing I kind of remember from back when, in the 70s and stuff, when all of this was going on, it wasn't about balancing your hormones. It was
Very
about,
good point.
oh, we've got a symptom. We'll fix it with hormones. She's going through menopause. Let's give her some estrogen,
Mhm.
It wasn't the way that we
Right.
manage things now by customizing things for people and really balancing out their hormones so they feel like themselves again.
That's a really good point. So when you come in for an evaluation, we are going to be ordering a full panel of hormone labs, not just a single one. We're going to order the full panel because we want to not only optimize each of those hormones, but keep them in balance. And that is super key to feeling your very best, right? So unfortunately, as we age, our hormones start to decline. For women, it's so sad. So basically, they're declining slowly and then all of a sudden, they're completely out. And that's called menopause.
Yep.
Our ovaries have a time limit and they produce those hormones and then they just stop. Some women, it's like the very next day. Sometimes it takes a few months, but the point is they just drop out.
Right.
And so we feel very deplete, and that produces huge symptoms for most women. Hot flashes being the biggest one, night sweats, sleeplessness, your brain doesn't work, you feel tired all the time, no libido, hard to maintain relationships with your significant other because of that. So those are the symptoms that most women will present with.
Mm-hmm.
Men,
what about men? Yeah,
men are a little bit luckier because they more gradually will lower.
Mm.
However, in this day and age, we are finding men age 50s-ish being very low. Like they're having testosterone levels of an 80-year-old.
Oh.
And so we're like, how did that happen? So probably stress, environmental toxins, bad lifestyle choices, sleep apnea. I mean, there's a lot of things that clue us into why a man's testosterone has dropped so significantly. And their symptoms are typically energy, like exhaustion. They're falling asleep on the couch when they initially sit down. They start seeing muscle loss and decrease in strength, of course, libido. And then when their testosterone level gets to the 200s, they often will have erection issues.
Right. And
So
that's hard for them.
Yeah.
Right, to even talk to anybody about it.
It is. A lot of times that's when they finally come in because they're like, oh, no. And they will finally get the guts, if you will, to come in and ask about it. But honestly, there's no reason to be waiting until you're empty, right?
Right.
Because we want to optimize those hormones well before they're in the 200s. Since we're on numbers, for men, we want to keep them above 800, depending on age, but 800 to 1200 is a good range to keep your testosterone if you're a man. And so that's kind of our goals, but again, it's very individualized. For women, very different. We want to keep you above 100. We're looking at like 150 is a really good level to be at, but over 100. And so very, very drastically different, but we want to optimize the hormones. And then kind of back to what you started with, we want to balance, right? We want to balance all the hormones, not just one hormone.
Yeah. And one of the things that I'm surprised that I hear from, some of my friends, people that aren't as familiar with bioidentical hormones, is they'll say, they'll complain of some of these symptoms, and I'll mention, why don't you get your hormones checked? You probably need to be optimized. And they say, well, I talked to my doctor about that. I went in for my annual, talked to my doctor, they did my labs, and they said all of my hormones are in range. So I'm good, And so my first response to them is, well, your doctor's probably not a hormone specialist, right? So you really need to go to somebody that is specially trained, which I thought brings up an interesting point. You've been doing hormones for many, many years.
Yes.
I mean, Paradise has been open over 16 years, but you started way before that, treating patients. How did you get started
into bioidentical? So I went to medical school at the University of Arizona, and Dr. Andrew Weil is there. And so he had a special student group that were holistic medicine. And so I really was very interested in that. So that's really how I started. Now, of course, they didn't teach me hormones back then, but I was in that world. And so as I finished medical school, then I went on for more training in holistic and integrative medicine. And that's kind of where the whole hormone avenue opened up, and specifically bioidentical hormones. And so I've been doing bioidentical hormone therapy for 27 years now, so a really long time.
I knew it was over 20.
Yeah, it's a long time, but that's kind of where that started. It was in my integrative medicine pathway, if you will. But hormones are super important. I mean, they have so many functions in the body, and we really need to pay attention. And your point is so well taken. What the lab gives you as a reference range is created by the average of the samples that come in, not any scientific basis of what it should be. So we want to optimize your hormone levels, and so just if they're in or out of range may be immaterial to me, because I have some optimal levels that I want to get you to. And that's based on science too, not just on me picking a number out of the air. So when you optimize your hormone levels, you are actually preventing heart disease. You're preventing dementia. You are preventing osteoporosis. And so these are significant chronic diseases that can be prevented and pushed off in time when you keep your hormones optimized. And so, yeah, it's really important. When my doctor said all my levels were just fine, and they say that to men too.
Right.
And I'm always shocked. I'm like, wow, you're a man doctor, and you're telling this gentleman that his level is fine. I'm like, it is not fine. It is far from fine. Men with low testosterone are more likely to have diabetes. They're more likely to have sleep apnea, be obese, and then of course secondarily develop heart disease. And so we don't ever want to allow that. Like, why would we choose that? I mean, think about it, centuries ago, we only lived to 40 or 50. So we didn't spend hardly any of our life without hormones, because we died shortly thereafter. So this is I know, this is a big deal. Now we're living more than half our life. Well, maybe not more, because we don't all live to 100, but we're living almost half our life without hormones unless you optimize them. And so that's why we have such severe chronic disease and disability in America, because we're not optimizing those hormones.
Yeah, and yet we're living longer. And the other thing that I sometimes hear from people is, oh, well, my doctor took me off hormone therapy because I'm through menopause now. Like, I'm done with all that stuff. And I'm like, stop right there.
Yeah, exactly.
Right? Because, why wouldn't you want to be optimized now? You're just going to
Exactly. You're just going to be emptied out after.
Yeah.
So that's kind of predicated on the notion that the symptoms of menopause for most women were only lasting, 1 to 5 years. And so they instructed us way back. And again, this is with those studies from back in the 70s with the synthetic hormones. Oh, if you must use hormones, as brief as possible, 1 to 5 years maximum. And so that's that old thinking, like, oh, you should be done with those now. I'm taking it. But that's not the thinking of today. We want to optimize bioidentical hormones for life.
Right.
For life.
And then you get all those great benefits that you were talking about,
Absolutely.
like with Alzheimer's, with different types of cancers and heart disease.
All of the things.
And even, I know for me, it's really enabled me to remain more active, right?
Absolutely.
I don't want to just, be a lump. I don't want to sit around and get old. I mean, who wants to do that?
Nobody does.
Right? You want to live your life and keep enjoying it to the fullest.
I agree. I will say, just from personal experience as well, based on that statement, we have a medical student right now that is shadowing us. And she's like, Dr. Sarna, you have so much energy. Like, she's all exhausted, like, I'm ready to go home. And I'm like, ah, and I'm like, yeah, like, shouldn't you be? You're 20. Like, what's going on? Maybe we need to check your hormones.
Right.
Yeah, I know. I mean, I went through that. It's very exhausting. But it was just something that she said to me. I'm like, you know what? Like, that's not the first person that has noticed that I have vitality and I have energy, and I'm almost 57. So, that's a long time. So I think that, I'm so happy that I have been optimizing my hormones I've been doing it for 10 years now. And so I would, recommend it for everybody, because it really does, your quality of life is so much better. I guess that's the big deal, right?
Yep. It's funny because you put me on hormone replacement therapy 14 years ago. Crazy, right? Yeah. And I remember at the time my husband was like, oh, whatever. After that, very shortly after that, he started telling everybody, like, oh no, you should do hormone replacement therapy, because he got his wife back.
Yes.
Right?
Yes.
So
Yeah, it is a big deal, and I don't remember if it's on this particular banner, but like when I first went through training and whatnot with BioT, which we're going to focus on next, it was all about benefiting your relationships, right? Because that's so important. I mean, as human beings, we are meant to be paired with another human. I mean, we don't really walk this earth by ourselves very, it's not very common, if you will. And so relationships are important, and having balanced hormones, both, it doesn't matter what sexes you are, you will just be better together if your hormones are balanced.
Right.
So yeah, exactly. So let's talk about different types of bioidentical hormones, because there's different routes you can use to optimize your hormones. My favorite, of course, is the BioT method. So this is the best option for everyone, and it's because the delivery system is the most effective, the most efficient, and the most convenient. So we take powdered bioidentical hormones. That powder is compressed into the shape of small pellets. I think in her hand she has a little pellet, and that is implanted in a little fat just above your butt.
Yeah, we all have that.
Yes. Yeah, we all have a little fat above our butt. So the pellets are implanted there. Capillaries will grow right around where the pellet is sitting. So every single time your heart beats, you are going to pull a small amount of hormone into the bloodstream, 24/7, continuous forever. As long as your heart is beating, you are pulling hormone into the bloodstream. And so that is why the delivery system is so ideal.
Yeah, it's like your body's manufactured it itself, right?
Exactly.
It's not like a time release where you take a pill, the levels go up, come down. It's just happening naturally.
All the time, exactly. And for women, that will last them about 4 months. For men, because they get 10 times the dose we get, it can last up to 6 months. So that's also convenient, right? So if you only have to do something every 4 or 6 months, that's amazing.
Yeah.
Everything else, you have to do it almost every day, twice a day, etc., which we'll talk about those just so you know that they exist. But the BioT method is really the best option for everybody. And I really love how we use a dosing site to calculate your individual dose that takes into account your medical history. So for example, if a woman has a history of endometriosis, her estrogen dose and progesterone is going to be different than if you did not. If a woman has a history of severe acne, her testosterone dose is going to be different than someone who does not. And so all of this is taken into account when we figure out what the dose is going to be right for a particular person. And that's why I really like it.
Yeah.
There are other options. You can replace your hormones with a cream, a topical cream that's applied to the skin. The reason why we don't like that as well is only like 60% of people absorb through the skin very well anyway, so I just don't get very good blood levels, because we do always recheck the blood levels after we've supplemented hormones, and we just don't get that very good of levels with topicals. You can also use a cream that you put in vaginally for the women, and that is a better absorptive surface. It's a mucous membrane, so it's like the inside of your mouth, and it absorbs better, so we'll get a better blood level, but it doesn't last 24 hours. It might last 8-10 hours. That's it. You can also use your mouth. That's a mucous membrane, and that's usually with a lozenge, and you put it in your mouth and you let it melt between your gum and cheek. And that's great delivery system, right into the bloodstream immediately. It lasts even shorter time. It lasts probably 6 hours. So the person that might choose that will do it twice a day. But still, you're just getting 2 6-hour peaks, and you're getting a peak and a whoop. And the pellets are continuous all the time. There's no big peaks and big valleys. It's continuous. I mean, you can change your delivery if you're running versus sleeping, but other than that, it's a continuous delivery. But there are other options, because not everybody wants to do pellets, but it is always what we recommend the highest. And I even recommend it, you had mentioned, how we can reduce cancer risk as well with optimizing hormones. So I get a lot of questions about, what about breast cancer? You know, I heard that you can't use hormones because it causes breast cancer. So let me kind of clarify that myth. So natural estrogen and progesterone does not cause cancer ever. Because if it did, when we're in our 20s and especially when we're pregnant, we'd all have breast cancer because that's when our estrogen and our progesterone levels are the highest. And so that obviously makes no sense. So natural hormones don't cause cancer. Now, if you already have a cancer that is hormone driven, it'll grow it. It doesn't matter what kind. So that is important to know. So we do make sure all of our ladies have been up to date on some type of breast cancer screening. Because if they already have a cancer and they're just unaware because they haven't had any screening, we could be growing their cancer, but we're never going to cause it. Never. Right. We're never going to cause it. And the other really cool thing that we've learned about testosterone in women, especially, is that it actually will decrease your risk of breast cancer. So Dr. Rebecca Glacier did these huge studies. I don't think she does this anymore, but she was a breast cancer surgeon. And she was turned on to the effects of testosterone on breast cancer, finding that it downregulates one of the special receptors in the breast tissue and decreases risk of breast cancer. So she was using testosterone pellets in her breast cancer patients to help prevent a recurrence. And she has good evidence that's been published that she had huge declines in recurrence of breast cancer in the patients that did the testosterone pellets. So cool. It's super exciting. So women who are afraid of breast cancer, still you can come see me and it'll be fine. If you've had breast cancer, we can still help you. We're not going to give you estrogen or progesterone, but we'll give you testosterone. And so it's really available to everybody. People don't have to live with deficient hormones and all the symptoms and effects that come along with that.
And then Dr. Sarna, do you ever treat patients that are younger, like they might be in their 20s or their 30s, right? But maybe their hormones need to be optimized.
Yes.
And if so, then how, are they treated in the same manner as someone who's aging and their hormones are naturally depleting with age?
So both yes and a no. So with the younger women, they will start to experience symptoms from lack of hormone balance. So we're using a lot of progesterone in the younger women because that's the hormone that drops out. Those ovaries are still making the estrogen, but the progesterone may be out of balance. And that's typically delivered in a capsule that you'll take. But also in the younger women, you can start to see a decline of testosterone. And we measure that. So the point is we treat you the same in the respect that we measure your hormone levels. We treat you differently in the respect of how the doses we use and what we use. It's based on what's deficient and what needs to be balanced. But we do treat women that are younger than your traditional menopausal age, but we also have women that are 70 and 80.
Right.
It's pretty amazing. Right? Yes. And one of the main benefits you'll continue to get when you're in those decades is bone health. So you will maintain better bone health with your hormones than any of the prescription medications on the market. And so I have several older women who came to me because they have osteoporosis and they did not want to take the medications their doctors were suggesting. And I said, well, testosterone builds bone faster and better than any of those medicines. Let's start with that. And then we recheck their bone density. We're absolutely seeing improving bone density. And so they're very happy because then they also have better muscle mass, better energy, better brain function. They're like, where was this all my life? Oh, we've been here. Yeah. Someone probably told you not to come, but we've been here. So yeah. So yeah, that's a great question.
Thanks.
All ages, not all ages, most ages.
Most
ages are candidates, and it's really driven a lot by the symptoms that you're describing. You want to see a hormone expert, and you want to have your blood levels checked.
Yeah, absolutely.
Yeah.
Wonderful. Thanks.
All right, so we have a couple other things that the wellness team does that we'll move on to. Something that is super popular right now is the semaglutide, tirzepatide, which is your Ozempic, and Mounjaro medications that are out there for weight loss. So these medicines were created for diabetes, but what was really fascinating is the fact that they work in multiple different arenas. They were actually helping people use their sugars more efficiently, decrease their insulin levels, which means they were storing fat less, and they were starting to lose weight. They had some effects of not feeling hungry, not having cravings, and also not being able to eat a whole plate of food anymore.
Right.
And so all of those things benefit weight loss. So of course, they started to be used in non-diabetic patients. And so initially they're like, oh my gosh, like that's horrible. Why would you ever do that? But what's really amazing is now that we've had millions of people utilizing these medications off label, if you will, we are seeing huge improvements in health, decreases in cardiovascular problems. So one side benefit of these GLP-1s are that we decrease cardiovascular risk. We're seeing improvements in memory and brain function. We're even starting to see decreases in inflammatory conditions, because when you decrease your sugars and your insulin, you have less inflammation. Right. And so it's pretty dramatic. I think it's going to be one of those things that they say, we should put this in the water, because most humans will benefit. Now, the ones that are going to benefit the most, of course, are the ones that have a broken system, right? So they're insulin resistant, they have elevated sugars, maybe not diabetes levels. They have fatty livers or obesity around the middle. Those people are usually the ones that are going to benefit the fastest and the most, because that's what this drug fixes. It fixes that machinery. And so it's been really very cool. By the way, GLP-1 is something that is produced in our bodies naturally. So it's not a drug that we need. It's that we need to enhance our own production of GLP-1. And we do that with exercise, with sleeping through the night, and with healthy diet, which I know that's the hardest part, right?
Right.
Americans are like, they're always like,
Supersize me.
So you can do this without any drugs, because you make this hormone yourself. It's a peptide hormone. You make it yourself. You just need to enhance how much you're making. But because, we live in the world we live in, and it's challenging, it's nice that we do have these other options to enhance that level and have the benefits of it. Not everybody's a candidate for this drug. I mean, we have to be careful, and we screen our patients well. We do a multitude of blood tests prior to starting therapy. We monitor our patients closely. We repeat labs because you can have problems.
Yeah.
The side effects of the medication can be significant, creating pancreatitis, severe constipation, obstipation where nothing's moving, or at its worst, someone's running to the hospital because they feel like their intestines are going to burst. I mean, that's kind of dramatic. But the point of being like having those side effects, vomiting significantly. So there are some major negative effects that could happen.
Right.
I think they're kind of finding that the folks that are having those bigger negative side effects are using the product incorrectly. They're using max doses. They're dosing themselves multiple times. They're kind of like, if a little bit's good, a lot's better. So they're not under the supervision of a physician. And I guess that's where I'm going with all of that, is you need to be under a physician's or a medical provider's supervision. You shouldn't be getting this, online, through the mail, in a space that you're just popping in and buying it and running home. So you really need to be evaluated and monitored to make sure this is right for you and that it's safe for you. But it works really well. Tirzepatide sometimes we use when someone's not getting over the nausea from the semaglutide. It seems to be a little bit better tolerated than the semaglutide, or maybe they've plateaued with their weight loss and they want to try the tirzepatide. That works sometimes. It doesn't always work, but sometimes it does. And so that's an option. The disadvantage of tirzepatide is just a lot more expensive.
Yeah.
It's a lot more expensive. But both of these medications are available. We call them peptides because that's what they are. We still do HCG. Not a lot of people do that, but the people that do choose HCG, by the way, are the ones that need that rapid weight loss. Like, I have a wedding next month and I need to lose 15 pounds.
Right.
Like, that's the HCG person that doesn't care. Well, they probably care, but their biggest goal is that they lose it super fast because they have an event. And so we still have that available typically as well. But the other products are for a slower, more gradual weight loss, usually over about 6 months, which might bring up another question, like how long do you stay on it? We have you stay on it till you get to your weight loss goals, and then we start to wean you off of it. Because it's not meant to stay on forever, unless of course you're diabetic. So if you're using it for weight loss, it's, really until you get to your weight loss goals. And then we'll help you transition off. There's natural supplements that we may introduce. There's a lot of different things that we can do, but that's very popular right now. And our appointments are pretty stacked with that, but that is still available through Paradise Med Spa and Wellness. We do have another peptide that we use that is called Sermorelin with glycine, and its biggest purpose is to help you become more lean. So that is weight loss, but really it's muscle building. So it's focused on
the
muscle
body composition.
Exactly.
Okay.
So body composition is what that peptide is more directed towards, which by the way is very important. And when you are losing weight, you do want to maintain your muscle, so you can combine the two. There is a package that you can combine the semaglutide with the Sermorelin so that you are helping your body maintain muscle while losing the weight and the fat, because in the long run, that's what it's all about, right?
And would that be an individual that maybe works out a lot, or it doesn't necessarily have to be?
It doesn't have to be, but I will tell you the people that are interested in it are the ones that are working out and they're not seeing the gains that they were hoping for.
Okay.
But you don't have to be that person to benefit from this peptide. As I said, it's nicely blended with semaglutide to minimize the muscle loss with weight loss. But yeah, so that's available. And then the other things that wellness does, and wellness does lots of things, but I'm kind of highlighting about 4 things. So we talked about hormones, talked about peptides, and then I have some props here for some of the things that we do. This box in the back is our Prolon kit. So Prolon is prolonged fasting. So we know from centuries of data that fasting is very important and very good for the human body. It allows the body to slough off old dead cells, and I'm not talking about skin, but all the old dead cells, they call them zombie cells, and it helps to reset your metabolism and to rejuvenate your cells, including stem cells. And so it's an important thing that all of us should be doing. You can fast so many different ways, but what studies show is if you can fast for 3 to 5 days, you're going to get the most benefits from that.
Interesting.
So you'll get benefits from intermittent fasting. I'm not trying to put that down at all, but you're not going to get the cellular rejuvenation and the zombie cell clean out unless you are fasting for a minimum of 72 hours or 3 days. And doing that without anything is very hard and sometimes dangerous for some people, right? It's not appropriate for all people to be fasting, especially for 72 hours.
Right.
So Prolon allows you to fast for 5 days, which is awesome. But the reason why you can do it is it's going to provide you with some nutrients each day, but that keep your body in a fasting state. And this was studies by Walter Longo, and he did most of his research on the blue zone people, etc. Lots of research behind this, and so he created this, and it's very, very doable. So each day there's a box of things you consume. There'll be a bar in there that looks like a protein or breakfast bar that has a combination, mostly nuts, by the way. It's mostly fats and nuts, believe it or not. That you'll consume. It'll have a packet that you're going to make a soup out of, which is going to have a lot of inulin fiber in it. That's really important. It might have olives one day. It might have some kale crackers, but there's some nutrients in there, so you're not starving to death.
Right.
So you're getting about, I believe it's between 700 and 1,200 calories, depending on what day you're on. First day is like 1,200 and it goes down. So you're getting some calories, and that's how you can do 5 days of fasting and still get all the benefits. I really like it. I try to do it at least twice a year. I usually do it after summer ends, vacation, so August-ish, or after holidays. I always say January, but it ends up being February. So February and August are usually the 2 times of the year, and it's only 5 days. And so I think it's a really good tool. Dr. Longo actually recommends the best benefit for someone is to do it 3 months in a row, 5 days on, 25 days off, 5 days on, etc. A series, if you will.
Okay.
That's what his main research was, to get the biggest bang for your buck. And I think that's a great way to do it as well. So it's really cool. I recommend it. And we do carry that here at Paradise. And then the box on the bottom is our 6-day detox kit. And this does some similar things, but totally in a different way. And so this is a 6-day program, and its goal is to assist your liver in unloading toxins. So we build up toxins every day. From the air we breathe, the foods that we eat, all of those things, we build up toxins. And our liver's sole purpose is to detoxify our body. That's what it does every day. It's like your pool filter, cleaning your pool. And so it's important to help your liver unload those toxins whenever you can. And this is another thing that could be very easily put into play post-summer and post-holidays, because your liver needs that assistance. This kit I really like because it's not only providing you with some supplements, it's actually a powdered supplement that you make a drink out of that addresses the liver, but it also has drops in there that address the lymphatics. So our lymphatics also hold toxins. So when our lymphatics are flowing, we unload toxins. And so the drops address the lymphatics. It has capsules in there that are for your colon, right? Okay. So one of the ways we eliminate toxins is through our poop, through our colon. So we either pee it out or we poop it out. So we cannot be constipated. You must be having a bowel movement every day to get rid of those toxins. When you have stool that's just sitting there, then our body resorbs the toxins.
Lovely.
The raw material is still ready to go, but it resorbs. So we don't want that to happen. So it has capsules in there that address the colon to keep it moving. And so and then it also has probiotics, which also help the colon. Okay. But because it's addressing all of those systems, you're gonna have the best detoxification you can. Now, what do you eat? So you get to eat foods. It does have a booklet. It says, do not eat any of these things. All these things are okay. So you can imagine you're not gonna be having sugar. You're not going to be having excess caffeine. You're not going to be having prepackaged processed food. You're not going to be having gluten, dairy. So there's a lot of things that won't be on there, but fresh vegetables, fresh fruits, lean proteins. They usually recommend a whitefish protein as your base. You can even have some white rice, but so you'll have a limited choice, but lots of it, like tons of things, but limited choices while you're doing the detox. And the hardest thing for me and for a lot of my friends, family, patients is the caffeine. So caffeine will slow down your detoxification. It doesn't prevent it, just slows it. So you're not supposed to have a lot of caffeine, or really, you're not supposed to have caffeine when you're doing the detox. And so that's sometimes challenging. So for my Elfie Clausens that do the triple shot twice a day of caffeine.
That's how she has so much energy.
Yes. She'd usually say, okay, I'll just have one coffee and then I'll be done. Huge difference. So it makes a big difference. So it's good. Yeah. It's good. Hopefully she wasn't watching and is unhappy that I said that. Everybody knows that. She's not a secret. It's not a secret. So this is also a great tool, a really good tool to improve your overall wellness and health. And so we have a lot of tools. I mean, come have an appointment with us, have a consultation, be it hormones or I just feel like crap and don't know why. Come and talk to us and we will help you figure it out. As Janet said, our special this July is $50 off a consultation for hormones. Take advantage of it. We're here for you, and if you have any questions, obviously we will always be available to answer them.
Yeah. And I always tell patients when patients or friends of mine that say, well, how do I know if I need this? And I just tell them, if you're not feeling like yourself, then you need to get it checked out, right?
Yeah.
So it's an indication that something's not right.
Exactly.
So if you're not feeling your best, not feeling like yourself anymore, that's a good indication that you need to come in and see us.
Yeah. All right, well, I hope everybody has an amazing rest of the month, and then we'll be back here, next month for Wind Down Wednesday?
The second Wednesday of the month, Dr. Weiss and I will be back, and we'll be talking about the Brella treatment for excessive underarm sweating. So something a lot of us can relate to, especially this time of year.
Absolutely.
Right? Why it's so hot. Well, thanks so much, everyone. We appreciate you joining us.
Thank you. Bye.
Bye.